Imagine being in a hospital. From your bed, you hear soft footsteps moving down the corridor. A nurse enters the room, wearing a white uniform, a calm expression, and the promise of care. But what she brings is not relief. She's not there to heal you. She's there to kill you. A lethal injection, a signature in a registry, or a silent order is enough to turn a medical vocation into an instrument of extermination. This nightmare is not fiction. It happened in Nazi Germany. Hadamar, a quiet German town, was transformed under Nazism into a symbol of extermination disguised as medicine. There, at the Psychiatric Institute, Irmgard Huber rose to become the highest authority within the nursing staff. From her position as head nurse, she not only managed personnel, but turned orders to kill into part of her daily routine.
Obedience was still very much a part of the way nurses were taught and the way we thought. So it's not surprising that the nurses in the Nazi era got caught up in all this.
Huber supervised lethal injections, organized death records, and manipulated medical documentation to conceal the crimes. Under her authority, each patient was reduced to a number that had to disappear in the name of racial hygiene. Her white uniform and institutional power ensured that Hadamar functioned as an administrative killing machine. The context of her work was Aktion T4, the secret program created by the Nazi regime to eliminate those considered people with lives unworthy of living.
T4 stands for Aktion T4, which is named after the location of the offices on the Tiergartenstrasse No. 4 in Charlottenburg, Berlin. It is a special unit set up on the orders of the Führer to expand the euthanasia program to the worthless lives of mentally ill patients. This has resulted in certain savings in terms of doctors, hospitals, and nursing staff.
Adults and children with physical or mental disabilities were sent to institutions like Hadamar. Nazi ideology justified extermination as a way to free resources for the healthy, turning hospitals into factories of death as official state policy. Huber embodied that transformation. Her role was not secondary, but essential to keeping the system running. The Führer's words had taken deep root in her thinking, and she was convinced she was fulfilling a vital mission for the future of a superior Germany.
You must understand, there are certain elements that must be removed from our racial community. There is a need to cleanse the diseased element from the German people. If you have someone who is deformed, handicapped, mentally ill, or has an incurable disease, they must be removed. For although they have a life, it is a life unfit for life. They are a burden on society.
The numbers speak for themselves. Between 1941 and 1945, around 15,000 people were murdered at Hadamar. Gas, lethal injections, and starvation were the most common methods. Each day followed the same ritual. Patients arrived, were selected, eliminated, and then erased through falsified death certificates. Huber stood at the center of this process, ensuring that nothing deviated from the imposed standards of efficiency. The routine was so methodical that Hadamar became a model institution within the Nazi euthanasia program. What makes Huber especially disturbing is that she was not merely an administrative figure. She was the human face of death. Inmates, many of them children or elderly, saw her enter their rooms wearing a white uniform. What should have symbolized care became a premonition of the end.
You may wonder how, as a nurse who is meant to save lives, I can take the lives of the mentally ill. Well, it is as I have said. In the words of the Führer, their life is a life not worth living. We must preserve the purity of the German people by preventing the weaker from breeding their inferior stock into our people.
Her apparent calm, the cold precision of her orders, and the efficiency with which she managed extermination conveyed the idea that death was simply part of daily work. For the staff, her authority was unquestionable. For the victims, she was often the last face they ever saw. As the war drew to a close, that system collapsed. The fall of the Third Reich did not bring impunity for Huber when Allied forces liberated Hadamar.
Irmgard Huber, then head nurse of the hospital, was among the staff arrested by the Americans. Her claims that she never killed patients were corroborated by co-workers and witnesses, and she was released. However, she did not escape justice. For serving as an accomplice to murder, Irmgard Huber received 25 years in prison. It is believed that she avoided the death penalty only because she was a woman.
Her case proved that guilt did not rest solely with doctors who signed orders. The nurses who carried them out with lethal precision shared full responsibility. Her conviction made it clear that the white uniform offered no protection. At Hadamar, it had become a symbol of extermination.
In the early 1950s, however, American authorities bowed to Cold War political pressure and issued amnesties and clemencies for many convicted Nazi perpetrators. Despite her proven role in numerous murders, Irmgard Huber was released from prison in 1952. For the rest of her life, Huber lived as a free woman in the town of Hadamar until 1983, when she died at the age of 82. There were no tears shed for Irmgard Huber.
If Irmgard Huber represented administrative control, Hilde Wernicke embodied the cold efficiency of direct killing. Trained as a nurse, her career under the Third Reich led her through hospitals and concentration camps, where she became a regular executioner of eugenic policy. Her routine was simple and deadly. Select patients, prepare syringes, administer lethal injections. She did not merely obey orders. Her participation was active, deliberate, and methodical. In her white coat, with precise movements, she personified the transformation of nursing into a weapon of extermination.
Nurses were involved in actually the killings themselves, either through active means or through passive means, letting patients starve, or exposing them to hazards where they would get pneumonia and other things and die.
During the most intense years of Aktion T4, Wernicke worked closely with doctors to eliminate disabled and mentally ill patients. The victims were defenseless men, women, and children who, instead of receiving care, found in her their executioner. Later testimonies agree that she showed no hesitation. The injections were administered with the same gesture as a treatment, except that in this case, the outcome was death. The full scale of her crimes is difficult to measure, but investigators concluded that Wernicke was involved in the deaths of hundreds, possibly thousands of people. Her work spanned years across hospitals and camps, reinforcing the efficiency of the euthanasia system. Each victim strengthened the machinery designed to purify German society, according to Nazi ideology.
Before Hitler came to power, across the world, the whole theory of eugenics was something that many nations had embraced.
Eugenics is the belief that through selective breeding, whether it's cows, sheep, people, whatever, through selective breeding, positive eugenics is the ability to breed offspring that will carry the best traits.
What made Wernicke particularly sinister was the normality with which she carried out these acts. Preparing a lethal dose of morphine or poison was, for her, no different from preparing a sedative. Her hands were steady, her gestures automatic. repetition turned murder into a bureaucratic routine. Colleagues recalled her impassive expression, even when small children cried or patients begged for their lives. Indifference was her most powerful weapon, reinforced by lies sent later to families to explain the deaths.
Public health nurses would go to the families, promise them, if you will give your child to us, your child will get the best care. And so people were falsely led to believe that and relinquish their children. The nurses were involved in the killing of children by giving them overdoses, by taking them outside knowing that it was going to contribute to their death.
Aktion T4 provided the framework for her crimes. While doctors decided who would die, nurses like Wernicke carried out the executions. In that sense, she represented the executioner's arm of the program. Her actions showed that Nazi ideology required not only theorists and officials, but trained hands capable of turning doctrine into death. At the end of the war, anonymity did not save her. Wernicke was arrested and tried for crimes against humanity. Documents and testimonies demonstrated her direct involvement in multiple murders. She was sentenced to death. Her conviction shattered the myth that women in the Third Reich were merely passive witnesses. Hilde Wernicke had been an active executioner. On January 14, 1947, she was executed by guillotine. At the heart of Ravensbrück, the largest women's concentration camp of the Nazi regime, saw a woman in a white uniform became a symbol of terror. Elizabeth Marshall, head nurse, represented not care, but judgment. With authority over medical staff and control over prisoner selection, she turned nursing into an instrument of extermination. Every decision she made could determine life or death.
At Ravensbrück, Marshall was in her position, responsible for numerous crimes committed against female prisoners. Ravensbrück, opened in May 1939, was the only major women's camp established by the Nazis. In total, some 132,000 women from all over Europe passed through the camp, including Poles, Russians, Jews, Gypsies, and others. Of that number, over 92,000 women perished.
Ravensbrück was created as a camp for women, but it quickly became a laboratory of cruelty. Marshall played a central role in organizing executions and medical experiments. She supervised the camp hospital and actively selected prisoners for endurance tests, surgeries without anesthesia, and pointless, agonizing procedures. Each name she marked represented a life condemned to suffering. The number of victims is staggering. Thousands of prisoners were executed or used as human test subjects under her supervision. Young women, mothers with children, elderly inmates, and even girls were subjected to experiments. Many died during procedures. Others were left mutilated until death. Marshall ensured that orders were carried out without deviation.
Marshall's duties at Ravensbrück also included overseeing these medical experiments and selecting prisoners for execution. Every night before the executions, she went to the infirmary camp hospital and selected the names of the women to be liquidated from the sick files. Subsequently, Marshall also compiled lists of those murdered. Together with the SS doctor, Percival Treiter, Marshall participated in the random selection of 800 female prisoners, who were then sent to Auschwitz-Birkenau.
Although Ravensbrück was not formally part of Aktion T4, it operated under the same eugenic logic. Racial purity and the elimination of the undesirable guided every decision. Marshall applied the same criteria used in euthanasia hospitals: selection, elimination, and falsification of records. What began in Hadamar reached extreme cruelty at Ravensbrück. The collapse of the Third Reich did not spare her. Marschall was captured and tried alongside other camp officials. Survivor testimonies identified her as a key figure in deaths and experiments. The verdict was unequivocal. She was convicted of crimes against humanity and sentenced to death. In 1947, Elizabeth Marschall was executed, becoming one of the few Nazi nurses to receive the death penalty. Her sentence confirmed that women's roles in the Holocaust could be just as lethal as those of any officer.
She was 60 years old when the British executioner Albert Pierpoint carried out the death sentence on the 3rd of May, 1947. Marschall became the oldest female Nazi war criminal to be executed by the British occupation authorities.
Today, it is clear that nurses were not passive accomplices or minor cogs within the machinery of the Third Reich. They were active architects of extermination. Irmgard Huber at Hadamar, Hilde Wernicke in hospitals and camps, and Elizabeth Marschall at Ravensbrück demonstrated how the vocation to heal could be twisted into a weapon of death. Nazism found in them a female embodiment of its murderous ideology. Their legacy reminds us that evil does not distinguish between gender or profession. Even those entrusted with protecting life were capable of turning the white coat into a uniform of terror. This brings us to the end. If you enjoyed this video, we invite you to join us in our next episode.